Camille Pita Guding, and this video is all about a return demonstration for skin assessment, which includes the skin, the nails, and the hair. But before we proceed for the assessment, we need to check first the patient's medical record. And before also assessing the patient, we need to check that our materials is complete. So I have here the alcohol, the tape measure, the ruler, and the gloves. And lastly, before touching the patient, we need to perform the proper hand washing before doing the skin assessment. Good day, ma'am. My name is Maria Stella Camille Pita Guding, the nurse assigned for you today. And ma'am, may I know what is your name?
My name is Johanna Gail Pita Guding and I am 13 years old.
Okay. So what do you prefer to be called during the assessment, ma'am?
You can call me Hannah.
Hannah? Miss Hannah? So this assessment is skin assessment, ma'am, wherein I will check the condition of your nails, skin, and your hair. And if I can see any abnormalities, I will write it down so that we can prevent further complications. And don't worry, ma'am, because there is a privacy and confidentiality because I closed the door and the curtains and it is just the two of us in this room. And all the details will be just between you and me. So do you have any complaints, ma'am? Are you okay today?
Yes, I am fine, thank you. It's just my itchy scalp.
The itchiness on your scalp.
Yes.
So I'll write it down. And I will check it later so that I can see if what's the problem. So before we can start the assessment, I need to put the examination gloves, or you need to wear it. So that the skin that doesn't include in the assessment will be covered. Thank you. So the first assessment is inspection, where I will check the skin discoloration, skin variation, and if you have lesions, cuts, and open wounds. So I will check. Ma'am, can you give me your arm or your hands so that I can check the condition of your skin? The other one, please. So I can say that you have white to light brown skin and it's normal, and I can see anything that have lesions or cuts and open wounds, so I will put it normal.
How will I know if I have skin lesions?
The skin lesions determine the size and color and shape, and to know if it's primary, secondary, or vascular, or do you have skin cancer lesions. Thank you for your question. And if you have further questions during the assessment, when I do the assessment on your skin, nails, and hair, you can ask me anytime. So since I can see anything in your skin and it's normal, I will proceed to the next assessment, which is the palpation. And first, I will check your temperature to know if you have hyperthermia or hypothermia. And during the assessment, I will use the back of my hands because this is more sensitive to the temperature. I can't use this palm of my hands and this thumb because this is less sensitive and this have more circulation on the blood. So I will use the back of the hand. So I will check. So I can say that you have normal temperature. Next, I will check if you have skin turgor, and I will just expose the skin below your clavicle and pinch it. If it's come back, it will come back immediately. It means that you have an absence of skin turgor. But if does not come back immediately, it means that you have a skin turgor. So can I pinch the down on your clavicle to see? So it comes back immediately. It means that the skin turgor is absent, which is good because it's normal. Next, I will check the texture of your skin, if it's rough or smooth. So can you give me your hand? The other one, please. So you have a smooth skin, which is good. It's not dry also. Next, Miss Hannah, I will check for edema.
What is edema?
Edema is a swelling caused by the excess fluid that are trapped inside your body tissues. And now I will check on your feet if there is any or if you have edema. So can you give me your feet? I will check. So if I will apply pressure on your feet and if it's invented, it means that you have edema, and when I pinch it and it will come back immediately, it means that you don't have edema. So let's check. So it comes back immediately. Let's see on this side. So I can say that it's normal and you don't have edema. So I'm done with your skin. So I will proceed to your nails. I will check first your hand if there is clubbing or anything abnormalities and the shape and size. So it's good. I can't see anything that is bad. Next, I will palpate the consistency of your hands, Miss Hannah. So I can really say that you're a healthy young woman. I can see any abnormalities in your skin and nails. Next, Miss Hannah, I will check for capillary refill. I will apply just like on the feet. I will apply pressure on your nail, and if it come back immediately, it means that you have a healthy capillary refill. And if not, will have low capillary refill. So I will check. So it comes back immediately. I'll just explain to you that if you have a low capillary refill, it is a sign of respiratory and cardiovascular disease that can cause hypoxia. So the next part, I will check your hair, and that's the last thing. But if it is fairly distributed, the color, if you have skin lesions or anything that has abnormalities, because you said earlier that your scalp is itchy. So before I will touch your hair, I will put my gloves. So now I can proceed with checking of your hair. I'll check it, ma'am, for you. If you have any lice or dandruff, because you said that your hair is itchy. I will check also if it is fairly distributed. So I think, so I know what's the problem and why you said that your scalp is itchy. I'm done, ma'am. So that is why you are having itchiness on your scalp. It is because I saw that you have dandruff. And as I checked, there's no lesions. You don't have lice on your head, in your scalp, just the dandruff. So I'll put it here so that it will prevent further complications. So I'm done assessing you, Miss Hannah. Do you have any questions about the assessment, or are you okay with the flow?
I'm okay.
So you don't have any complications
No.
about your body?
No.
Just the itchiness of your scalp?
Yes.
So I will read it to you, the results of our assessment. So in your skin, I can't see anything that are discoloration or color variation, all are normal, and I can't see any abnormalities on your skin. And also you have normal temperature, you don't have skin turgor, the texture of your skin is smooth, and you don't have edema. All are normal. And in the nails, you have a consistent hand, you don't have the clubbing, you don't have any abnormalities on your nails. So on hair, the only problem is that you have dandruff, so I already put it here, and that's it. Thank you very much, Miss Rihanna, for this assessment, and thank you so much. So I will remove now the gown, and I'll put it here. So we can now apply alcohol. And thank you very much, ma'am.
Thank you.